My name is Lucas Nickel. I'm a Johns Hopkins orthopedic surgeon specializing in hip and knee joint replacement, practicing out of Columbia, Maryland at Howard County General Hospital. When patients develop hip arthritis, they often develop decreased range of motion and find that the hip is becoming increasingly stiff. Some patients also develop shortening of the leg, which can be subtle or patients sometimes will notice. The other symptom of hip arthritis is pain, and typically that's pain in the groin, but the hip can also refer pain down to the knee or occasionally into the buttock. And the pain location is a little less reliable in hip arthritis than in other types of arthritis. Hip replacement is generally done once there is little to no cartilage left in the hip and when patients have pain which is not responsive to anti-inflammatory medication and activity changes. In hip replacement, the goal is to remove the ball portion of the hip. So the hip is a ball in a socket, and we remove the ball and we put a new post inside the bone, and then a new ball sits on top. On the socket side, we place a new metal socket with a plastic liner that allows the hip to move without friction. In hip replacement, there are a number of ways to do the operation. There are more than 20 described surgical approaches to the hip. My preferred method is going through the front, or what is known as a direct anterior hip. The big difference in the different approaches to how hip replacement is done is which muscles one is going in between or which muscles are being cut. I like direct anterior hip replacement because I'm going in between muscles and I'm not having to cut any muscle off of the bone. I find that this leads to a rapid recovery in terms of daily activities like walking or going up and down stairs. While there are many different surgical approaches to hip replacement, the truth is that hip replacement is a successful operation, and it is the most successful operation for pain in all of medicine. So it doesn't really matter which surgical approach is done all that much. However, I find that in my hands, my patients recover faster with an anterior surgical approach, and that's why I do this surgical approach. When I do hip replacement, I use a specialized table and we go through the front, which is a direct anterior approach. We make about an 11 centimeter incision over the front of the thigh and then go down in between the muscle to access the lining of the joint, which is called the capsule. We then make an incision through the capsule of the joint, remove the ball portion of the hip after cutting the bone, and then mill out the socket to place the new artificial socket, and then we place the new post inside the thigh bone or the femur. We then use X-ray to make sure that the length of the hip is appropriate and that the parts are positioned appropriately and correctly sized. When we are done, we place the final implants and then close the hip back up. We place a dressing on that can be removed at home, and there are no stitches that need to be taken out after the operation because everything is buried underneath the skin. In hip replacement, most people have moved to what is called a ceramic on polyethylene bearing, which is basically a ceramic ball that articulates with a specialized plastic liner. We have found this to be the type of hip replacement that has the lowest risk of complication and the greatest long-term survival. It used to be thought that hip replacements would only last 15 to 20 years, which was really because the piece of plastic that was in the hip was wearing out. However, with the new generation of plastic that has been manufactured since the early 2000s, we have not really seen hip replacements wear out in the same way. And so most hip replacements that are being put in now will likely last far longer and realistically may last 30 to 50 years. After hip replacement, most patients go home the same day, and a minority of patients will stay overnight after the operation. Most patients are using a walker for a week or two, but are back to most activities within several weeks. Most people are back to driving within 2 weeks if it's the left leg, and within 4 to 6 weeks if it's the right leg. After hip replacement, I generally don't send most patients to formal physical therapy because most of the therapy is just getting up and walking. And so we will give you some exercises that you can do at home, and that's sufficient for about 95% of people. Long term, after hip replacement, there are really very few restrictions in activities. We don't know if running or jumping is safe, so I counsel most patients that unless there's a reason that you need to do this, it's probably safer to avoid running and jumping activities. However, really any other activity you can do with hip replacement.